This is the story of one physician on a mission. His crusade to educate, helping us control our pain so our pain does not control us, and how he has turned his patients' tears of pain into tears of joy.
So, yes, I'm greatly indebted. In fact, he took me from a non-productive individual with a number of back surgeries to a productive individual where I was running 30 miles a week again. It chokes me up when I think about it because I didn't think it was ever possible again.
He just takes his time, he talks to you and explains everything to you, and it just really well, and he's really helped my pain. I mean, it's unbelievable. I'm golfing again, I'm exercising again.
Dr. Joshi is the most incredible doctor I have ever met. He has helped me get my life back together.
I don't know any other profession that can make you feel that sense of self-satisfaction as when a person tells you, you've completely changed my life, or even better, you've saved my life.
Meet Dr. Joshi, one very dedicated doctor in Chicago, treating patients who live with chronic pain every day, from our head and neck to our feet, to the most common pain of all, our lower back.
I have been so depressed with back pain for most of my life, and that has colored my life in a very negative way. Because when you have back pain, you don't get up in the morning the same way other people do. You just know it's going to be there, and you can't do the things you want to do. You can't be happy like other people are.
Persistent pain is a growing epidemic in America. It plagues almost 40% of our population, 116 million Americans, and the number goes higher if you include children, nursing home patients, and military personnel.
So the thought is that it's 1 in 2.5 people in America are affected by chronic pain directly. Now, obviously indirectly, that would basically mean everyone indirectly is affected by it. And by indirectly, it means you probably have a family member or a friend that has chronic pain. You probably are paying for chronic pain somehow in some insurance policy or some tax. So it affects everyone.
Everyone, including a working mom, a building contractor, an executive manager, and a police officer.
Well, I couldn't exercise hardly anymore. Hard walking, very hard, difficult. My back, my legs, hard time sitting in a car for long trips, even on an airplane. I mean, I just couldn't sit for long periods of time.
To add salt to the wound, many patients suffer needlessly because of improper treatment from untrained doctors.
I had 3 different chiropractors. I had acupuncture twice, and I gave up on those because it never worked. It would just come back within hours or minutes.
You'd walk in like that. You ready? All right. Bam.
And that's it.
That was it. Numb you up and shoot you with the juicer.
See you later. Yeah, the problem with that is obviously it hurts you as a patient, right? But it actually affects all of America. Because what happens is the patient will say, hey, I don't get better. They'll keep coming back for more. They won't get better. Insurance companies will look at that and say, you know what, we paid for we paid for 10,000 of these things and they're not working, so we're not going to cover them anymore.
Right.
Because they don't work. And again, they don't realize it's not the injection that doesn't work. It's the doctor that doesn't work.
I've seen patients, who walk through this door after they've seen multiple primary care physicians, multiple surgeons, multiple pain doctors, and the right diagnosis wasn't even made the whole time. The right procedure wasn't done, or the procedure was done incorrectly, and it's very frustrating. So when you see that years of their life is wasted on treatments that were inappropriate or treatments that didn't work, it's very frustrating, especially for the patients that didn't ask for it.
Patients also suffer at the hands of so-called prescription pad pain doctors who prescribe drugs that only treat symptoms, not causes. As the saying goes, take 2 painkillers and call me in the morning.
And I went in to see this pain doctor, and it was actually quite scary because one of the things that he did is he really didn't ask a lot of questions about what I did and so on and so forth. He had just started writing prescriptions, and I'm finding that was pretty much the industry standard. So it got to the point to where he was writing me prescriptions, and I was actually hospitalized 3 times from an overdose of the medicine that he had.
Patients living in agony for years, even decades, credit Dr. Joshi for saving their lives.
Yeah, it is a new lease on life. I came in and I told him I have no back pain, and he just smiled and he said, "You have no back pain?" And I said, "Yes." And it was just kind of a celebration because he has worked so hard to help me, and I have been so depressed with back pain for most of my life.
And I kept running into walls. And then I finally got the opportunity to see Dr. Joshi, and he realized what he was up against, and he did more than fixed it. He's monitored it, and I'm forever grateful, actually. Yeah.
Like an investigator, Dr. Joshi seeks the root causes of his patient's pain.
Dr. Joshi looked over about 5 to 7 different MRIs that I had had from the previous 8 years of going to doctors back and forth. And within about 35 seconds, he looked at me and he knew what was wrong.
35 seconds?
Seconds. And I was just flabbergasted. I couldn't believe it. He says, I know exactly what's wrong with you. And I looked at him and I said, no way. But he did. So within about, I would say within 2 weeks, we went through our first procedure, and I was 95% better.
After finding the right diagnosis, Dr. Joshi prescribes the right combination of medical care, whether it's through procedures, medications, diet, nutrition, Eastern or Western medicine.
He took away a lot of the things that I was using as crutches because he really wanted a good basis to start on. He really took a very holistic approach to the health, and I gotta say, I really applaud it because I fought it because I was starting to become dependent on the different medicines and thinking that was the only way. And he basically started me with a clean slate. He believes very much to staying ahead of the pain curve instead of behind it. So he's very proactive, but he's also very, very concerned about your overall health. And he has actually helped me with some other illnesses that I've had because pain does create other symptoms.
So I went in there, and it was the best experience I ever had in my life with anybody. I mean, he took his time, he explains it to you, he's not in a hurry to go anywhere, you know. He just, you don't see it in many doctors anymore.
How did Dr. Joshi start his own journey as a healer? Born and raised in Detroit, admitted to medical school at the age of 16, married to a fellow doctor, father of 2 children, and always inspired by his own parents to analyze and find the root of the problem.
My father is an engineer, and I think that's where I get my analytical side. And my mother was in healthcare. She was a nutritionist, and so I think that's where I get this idea of incorporating more than just injections and medicines, but actually having a full, comprehensive, quality of life, way of life approach when you treat patients.
Dr. Joshi defines the doctor as teacher, showing us the right way to prevent, treat, and manage our pain. He also wants to enlighten fellow doctors to embrace the connection between mind and body whenever treating their patients.
There's a lot of primary care physicians still to this day have absolutely no training and no education in their medical school or in their residency about chronic pain. So that's a major problem.
For Dr. Joshi, educating means sifting fact from fiction amidst all the information overload we face. Studies show 1/3 of patients diagnose themselves on the internet, and more than half are flat out wrong. Some patients are so confused they do nothing about their pain, which leaves them in misery needlessly. As Chris Mollenauer learned, there's no need to be passive.
See, it's not just back problems, it's pain in general. He's a pain management specialist. And him and I have talked about this numerous times, about how people just need to get educated on pain management. And whether it be your tooth, your thumb, your finger, it doesn't matter. No, you don't have to suffer at all. Not at all. I mean, if you're in pain, call someone. Don't deal with it. If you deal with it, that's when you get emotional problems, stress. But pain is not a bad thing. Pain is just something we can fix. That's what I've learned from Dr. Joshi. And he's fixed me 99.9%. And the other 1.1%, you can't do anything because we all get old.
You know, I've given probably about 400 lectures, both locally and nationally. And I think I've spoken to hundreds, if not thousands, of physicians during that time. And I know that some of them will take some pearls of wisdom away. And that's been imparted on a few other patients. And, you know, so maybe I've affected a few thousand patients, maybe 10,000 patients. But you know what? There's 300 million people in America. So 10,000 patients, 300 million, there's a lot of work to do.
A lot of work to do for this very dedicated doctor, driven by his passion and purpose to help us live happier, healthier, pain-free lives.
The joy of helping someone else is almost unparalleled. The ability to give someone function back, to give someone joy, to give someone hope, to allow them to interact with their family, to allow them to have a social life, to allow them to enjoy life again, is a gift that really money can't buy. And so it's a very fulfilling feeling.
He has helped me get rid of a lot of my depression. He has helped me put 10 more years into my life.
Dr. J. Joshi, pain doctor, physician on a mission, and a great messenger with a great message that we can control our pain instead of our pain controlling us.